Let me introduce myself first. Those who don't know me, I am Ramaya Mutiala, President and CEO of Indian Organization for Rare Diseases, which is organizing today's symposium. It's titled Role of Public Health and Rare Diseases. Let me say a word or two about the role of public health to set the stage for you. Some of you may know that the mission of public health is to fulfill society's interest in ensuring conditions in which people can be healthy. Public and private institutions charged with this mission to monitor population health and to respond when threats arise. To identify the causes of health threats, the public health practitioners use combination of disciplines that include basic sciences, epidemiology, statistics, healthcare services, etc., etc. The purpose of today's webinar is to highlight the public health issues related to 7,000 low prevalence diseases in our country. It is my opinion the applicability of public health approaches to rare diseases is limited because the patients are few and scattered. Current practices of public health professionals for finding and removing the risk factors are generally not well suited for low prevalence population. The knowledge of most rare diseases is insufficient. Therefore, orphan diseases do not attract researchers, medical specialists, drug manufacturers, and policymakers. Rare diseases patients have many challenges, as you all know. Collectively, rare diseases affect about 90 million people in India and about 400 million in worldwide. Most rare diseases begin in childhood and can have devastating lifelong health consequences. They can severely affect the lives of caregivers. Their economic impact is substantial for patients, families, and society. Rare diseases contribute to intellectual disabilities, and many have no cure, but some can be prevented or controlled. Despite these challenges, we have compelling reasons to believe that the public health approaches play an important role to rare diseases. In favor of this view, I illustrate to you a few large-scale public health approaches that have been successful applied to rare diseases. The services rendered by patient organizations through their policy efforts led to the legislation such as Orphan Drug Act. Screening of newborns to prevent developmental disorders resulted in mandatory fortification of folic acid. The prevention of genetic diseases such as sickle cell disease in India have been drastically reduced through population screening and strategies such as prenatal diagnosis for carrier couples and marriage avoidance between carriers. Now, with high certainty, I emphasize that the comprehensive public health approaches enormously benefit individuals affected by disabling, life-threatening, and unpreventable diseases. In this context, a host of activities fall within the public health arena. For example, prevention, slowing the clinical progression, social support, treatments, etc., etc. Today, in a few minutes, the experts share their views on health activities that are key to the management of rare diseases. Now, just a few notes for attendees. First, would you please place your questions specific to any speaker or general questions in the chat box? We will try to answer after the event. Second, we already sent the bios of all speakers to all registrants. Hope you had a chance to review it. This is to conserve the time of speakers to deliver their valuable messages in this limited time of webinar. Third and lastly, a slight change in the program. I will share my screen. Dr. Paul will speak at 5:35 instead of Professor Stefano. With this, With this short introduction, I now introduce Dr. Ruediger Krech, Director of Health Promotion, World Health Organization, will speak to us addressing the rare diseases as a grand opportunity to achieve universal health coverage. Dr. Krech, floor is yours.
Thank you very much, Ramaya, and dear colleagues. Let me first of all congratulate India for doubling the healthcare budget and include health promotion, disease prevention, and hygienic measures into the portfolio. This is the right step and a bold decision. We know from other crises that by investing in health, this will also yield economic and social effects that your country will benefit from in regaining economic speed. Honestly, I could never believe that India would not see these benefits and listen to those who regard health as a cost and not as an investment. The COVID-19 pandemic brings many of the societal shortcomings to the fore. And one of them is that many member states were not prepared because their health systems were too weak. With this recent decision, India is on the same path as Canada or Finland, who have seen the positive outcomes for their overall development. Of course, your GDP health spending, even with this doubling, is still much too low, and I'm sure you know that. But you are an incredible nation with incredible potential, because you are incredible India. You have shown again and again that you are able to deal with crises and that you address real challenges. One of these challenges unfold when dealing with people with rare diseases. The vision of the Sustainable Development Goals is a world in which no one is left behind, including people who suffer from rare diseases. Just because a disease affects a small number of people does not make it irrelevant or less important than diseases that affect millions. This actually is a quote that shall be the basis of my speech today, as it comes from our WHO's Director General, Dr. Tedros. With 300 to 350 million people affected worldwide and more than 7,000 different types of diseases known to date, rare diseases represent a major challenge in public health that has been largely ignored. Consequently, this is a field in public health and research that would certainly benefit from globally concerted action and international collaboration. Why, we may ask, are rare diseases a matter to be discussed at governmental level, at prime minister's level, and not only within ministries of health? Why are the solutions only possible if we act in solidarity across national borders? Viewing rare diseases through a global public health lens offers some perspectives. Rare diseases patients and their families are a particularly vulnerable group of citizens who experience scarcity of medical knowledge, difficulties in accessing adequate care, as well as isolation from society due to the rarity of their condition and the scattered expertise. In general, health systems are not adapted to rare diseases, and there is little public health policy to respond to their specific needs. Access to quality health care, overall social and medical support, effective liaison between hospitals and general practices, as well as professional and social integration, autonomy, and independence. Universal health coverage means that all people and communities receive the promotive, preventive, curative, rehabilitative, and palliative health services they need of sufficient quality to be effective, while also ensuring that the use of these services does not expose the user to financial hardship. Health systems can learn a lot from rare diseases to design systems that are fit for the future and effectively contributing to UHC. Rarity calls for increased international mobility of experts, as well as of patients, as the most clinically relevant expertise will most likely not to be available locally. Will innovative solutions in E and M health be able to pool expertise and develop virtual centers of expertise? Could they help to create expert structures for the management and care of rare disease patients and bring together multidisciplinary competences and skills to serve the specific medical, rehabilitative, and palliative needs of rare disease patients? Could accredited global centers of excellence help to provide best quality care based on available clinical evidence? Would we be able to globally find innovative ways of financing such as centers so that patients and their families will not fall into poverty because of out-of-pocket payments related to the care of their rare disease? Pooling seems to be one of the magic words when it comes to rare diseases. It helps to bring together the critical mass and balance low prevalence and incidence. It helps to focus the diffuse shadow light in which rare diseases are currently barely seen and create spotlights, pooling of research and development, pooling of data, pooling of care facilities, and pooling of experts. Lots of excellent work has been undertaken in recent years in this regard. The launching of the European reference networks is one of such initiatives. Could pooling also serve to bring in expertise from you here in India, from people in Japan, Australia, Canada, or China? A second word that comes to mind is collaboration. Sean Atkins and colleagues, when reviewing the recent Charcot-Marie Tooth research, suggested that it is unlikely that we are going to see a dramatic change unless there is a wholesale shift in the process of drug discovery and development, combined with increased collaboration between academics, industry, government labs, and research foundations in the rare disease arena. End of quote. How will such a shift be concretely orchestrated? What incentives could be created that instigate such change? One such incentive could be to collaborate to agree on thresholds for safe and clinically effective standards for diagnosis, care, and treatment, and to collect international best practice. And a third word might be smart innovation. As technologies are advancing, we are confident that we shall see a routine in vivo gene editing in a medium time horizon. I added smart to innovation, as again, the global community can and certainly will learn from rare diseases. We are faced with the option of editing the human genome with ease and precision. Notwithstanding the potential of these applications to the beneficial to any one individual, unforeseen risks such as epigenetic and intergenerational effects cannot be ruled out. Besides principled reasons, it is also because of these uncertainties that interventions seeking to modify the human genome are banned in many countries. On the other hand, the question posed by the US National Academy of Sciences and National Academy of Medicine is no longer whether or not the human genome ought to be edited. Rather, the question is what should be the criteria for heritable germline editing and what principles. So let me start again by looking at perhaps the third word of smart innovation, because otherwise we lose the thread of my argument. So as technologies are advancing, we are confident that we will see routine in vivo gene editing in a medium time horizon. I added smart to innovation, as again, the global community can and certainly will learn from rare diseases. We are faced with the option of editing the human genome with ease and precision. notwithstanding the potential of these applications to be beneficial to any one individual, unforeseen risks such as epigenetic and intergenerational effects cannot be ruled out. Besides principled reasons, it is also because of these uncertainties that interventions seeking to modify the human genome are banned in many countries. On the other hand, the question posed by the US National Academy of Sciences and National Academy of Medicine is no longer whether or not the human genome ought to be edited. Rather, the question is what should be the criteria for heritable germline editing, and what principles should guide the governance of human genome editing. Such a shift in the approach to germline editing would probably have global consequences for individuals, societies, and mankind altogether. So, on the way towards cure of some rare diseases, I humbly suggest going this path with caution. Colleagues, I'm sure that pooling, cooperation, and smart innovation will help to increase the attention to rare diseases globally. India has a lot to contribute and learn from this global endeavor. WHO is looking forward to being at your side, and I thank you.
Thank you, Dr. Krech. That's a message, very strong message you gave it to the Indian people and Indian government, Indian policymakers. And it came very clearly, power of collaboration and cooperation for these rare conditions. And you emphasized the gene editing, importance of it in the rare disease. They're all very important. Thank you very, very much for your kind comments and taking time to attend this one. Thank you. I now